Our next speaker is Bob Hess. Those of you in economic development in the room, if you didn't know him personally, you know him by reputation. There was a fellow who really is considered the father of modern economic development in America. And that guy was a guy named Robert Ady. This guy was legendary. Worked for a company called Fantas. And he had a young protege on his team, a fellow by the name of Bob Hess. Bob is now the executive managing director of Newmark, Grubb, Knight Frank's global corporate services practice. He was really the driving force behind the study that we're talking about today. He's responsible for strategic development, quality assurance, and business development for its consulting industry and group initiatives. He's a preeminent, sought-after service provider, respected leader in corporate location strategy, site selection for multiple industries around America, not just healthcare. He's conducted over 250 assignments on a global basis. Now, what he's going to do today, many of you have heard him speak about this study, but he's also going to involve you in a little interactive activity. Now, one little warning about this. Folks, we're going to collect these, okay? They're of no value. They're not a calculator, okay? There's something about this little item that makes guys want to put it in our pocket. I don't know why it is. It's like please don't do that. It costs us $37 every time you do that. So it would be nice if at the time when we ask you to collect them, you will. But before that, we're going to ask you to use them. Because we've asked Bob today to not just talk about this study, but to give you an interactive process to say, how might we really apply it? And that's what it's about today. It's thinking, how do we take these ideas and turn them into realities? Bob Hess is a guy who has worked with states and localities around this nation in helping them see visions and turn them into realities. Please join me in welcoming the Managing Director in Newmark, Grubb, Knight Frank's Global Corporate Services Practice, the Dean now of Economic Development in America, Bob Hess.
Thank you, Blake. Really appreciate that introduction. And I would like to make this presentation in the honor of my mentor, Bob Ady. He was a fantastic man. I am very honored to be here. Thanks to MEC, the Swayze Foundation, MEDC, Entergy, my partner Subsidian Healthcare, Brad Guest should be here, who helped us on a study. This was a very exciting opportunity to put this framework in place. Not only because it's about making a difference in people's lives and helping you create jobs and wealth, but I feel personally highly qualified. Everybody's got a personal story. I'm the father of two beautiful girls who were born with a fatal genetic disease. They've both been through bone marrow transplants and over 30 surgeries in their entire lifetime. So I feel a little qualified knowing about the system and how important healthcare is, and from both sides, the business side and the personal side. And I had a very passionate perspective on this and how we can help people's lives, because it does make a difference. This is about economic development. It's about job creation. It's about wealth creation. It's about working together. So a little bit about me, and then we'll get into some exercises. I work for a company called Newmark, Grubb, Knight Frank. The picture of that gentleman is a person named Howard Lutnick. If you all remember 9/11, Cantor Fitzgerald, he's the CEO of Cantor Fitzgerald. When that building came down, his entire company came down. To this day, he maintains health care and support of those people almost 12 or 13 years later. I enjoy working for Howard, and it's a fantastic company. This is the model that I work at my company. We work on the demand side. If you see this chart up here, this is a system. This is a life cycle of services. The demand side on the top and the supply side on the bottom. About the what, the where, and the how, which you're going to need to do for the healthcare industry. You're going to have to understand the demand side of the business, as well as the supply side. And you need to understand the whole industry life cycle. So this is the service requirement. This is what I bring to the marketplace. And it's the same thing you'll need to do for the healthcare industry. These are our clients. And I wanted to show you this because there's people out there making decisions in healthcare. Siemens is one of our top accounts. They have a healthcare division in medical diagnostics. I've been to Siemens. I've been to their offices in Milwaukee and in Germany. They're making decisions about where they deploy their assets. This is our clientele. and I'm proud to say Entergy is also one of our clients. I also just finished an assignment for a company called Electa. For some of the doctors in the audience that do surgery, they provide clinical solutions for treating cancer. They make something called the gamma knife, which gets into radiosurgery and things of that sort. I won't go beyond that. That's beyond my realm of knowledge. But these companies are expanding and constantly looking for places to deploy their capital, intellectual capital, make these products. It's a Swedish firm. So this is a very active sector. So there's a lot of activity in the healthcare sector. It's one of the fastest growing industries in the United States right now. So we have a lot of great private sector clients, and we leverage that knowledge. And then we have great public sector clients too, like the governor and Blueprint Mississippi. And we're very proud to say that we participated in the study, and we thank you, Governor and team, for the opportunity to do this. And I encourage the courage and the cunning and the collaboration that's going to be required to be successful. Why? Because this is a tough industry, a very, very tough industry. It's a different industry. It's not aerospace. It's not automotive. It's not your typical industry. It gets into all different types of components and perspectives, and we'll talk about that in a second. Lastly, the last thing about us. Newmark has actually made healthcare one of our top initiatives. We are investing in this. This is one of our top industries, and we get into the whole real estate side of the healthcare industry. So again, that's the background about Bob. So what about the study? What is healthcare? This was a difficult thing to do. So if you all look at the life science industry, it's a giant industry, right? It's huge. So where are we going to play? Healthcare is actually a subset of the life science industry. So we had to split this industry into 3 different areas that we thought would be relevant. One, the delivery side. Obviously, that includes physicians and nurses and hospitals and clinics and things of that sort. That's one side of the study, okay? So delivery, okay? The second is the support industry. That's the infrastructure, the cluster that supports that delivery. And then, of course, there was the innovation. So we had to look at all 3 of those sectors, all diverse, and it's a subset. So the first thing to remember today is, where are you going to err on the side, Mississippi, in terms of developing this industry? It's a huge industry. And it's also your ticket to getting into the life science industry, competing with the Massachusetts and the Californias and the other clusters. So healthcare really is the logical ticket to get into broader global life sciences, which you know is one of our future industries forever. And all the healthcare people understand it here. Why is it important? I think you saw a lot of these statistics, you've heard a lot of them, but let's talk about them again. 23% of the national growth in the last 10 years, 2.6 million jobs, 3.2 million more jobs by 2018. That's huge. Also, the sector can attract young, next-generation talent and position Mississippi in a new image. Technology-savvy work processes. This is, again, a very important part of this industry. Excellent economic impact, fastest-growing occupations, very associated with technology and supply chain and process. So understand what you're going to have to do in your educational systems to compete in this industry, where you're going to need to invest. I know all the things that are on the docket for the state of Mississippi, but this industry will put a microscope on this issue of education, talent, and the interplay between those sectors. What the goals of the study were, they were about measuring themes. This is about workforce development. It was about quality of life and place. Actually, you know what, take the word quality of life and put it aside. It's kind of a broad term. Quality of place. So around the medical corridor, what is the quality of that place? Where people stay, when they come and visit, when they provide, there's going to be surgeries and things of that sort. What are they going to eat? Where are they going to stay? Young people, if you're going to attract the top talent in the world, they want to have environments and urban neighborhoods and walking places to make things happen. This can happen in Jackson, and of course it can happen in Tupelo and other cities. But again, this is going to require you to look at quality of life and place much differently than you have in the past. Business sustainability. Obviously, this is about costs and productivity, absenteeism, the workforce in this industry, and of course, creating economic wealth. Not only just a business attraction, but retention, entrepreneurship, and innovation. So here's another challenge. Does the world associate Mississippi with small and medium enterprise, venture capital, and this whole innovation side of the economy? Absolutely they will. You have to do that. You're starting that, and that's a very exciting sector of the economy. And this relates back to the issue of being an economic driver. So the goals there, of course, of economic development are to enhance competitiveness of the state, create jobs, wealth, and overall positive impact. Right. So is the healthcare cluster going to contribute to that? Absolutely. We talked about the drivers there. But this is going to get back to the competitiveness of the state. So do you focus on inside the four walls in Mississippi first to attract this industry outside the four walls? What's the priority? Think about that. So do you, and that's what this healthcare zone act, which is fantastic, creating success stories in small clinics and small communities. We love those success stories to show the Baxters and the Medicagos of the world that it can happen here in Mississippi on a more grander, scalable situation. So again, competitiveness of the state is going to be something you need to think about, and how you're going to measure that and position this industry. Do you focus on inside the four walls, being a kind of an industrial engineering background, or outside the four walls? And the fact that healthcare is an ecosystem. So look at the graph. Part of you're all familiar with the word cluster, ecosystem. Well, driving that cluster is a lot of interrelated industries. This is just one slice of the healthcare industry. It's the commercial side of the industry. All of these medical device and clinical testing, vaccine R&D, healthcare IT, huge right now. Huge healthcare IT and supply chain in the healthcare industry. How is this all working together? And then there's regulatory agencies, tech transfer, tech training programs. We found in our study small little regulations that have been around since the 1930s or 40s about how physicians' assistants can support and access in Mississippi. That can just go away. That's just something that you just find because you do your job and you look at the details and you understand what can happen out there in the rural parts of the state. But now, you're going to have to understand that this industry, now look at all these factors that are involved. You're going to have to measure all of these factors. You're going to have to get in to understand skilled manufacturing labor, tax environment. So take a look at this chart. There's a lot of work to do here. Where do you focus your time? How do you weave into this? This cluster requires a lot of different measurement and understanding these, what we call critical location factors in business drivers. And you're going to have to measure these business drivers. This is what's important to companies. You have to score yourself. Are you ready to score yourself in this industry? You might not like some of the scores, and you might love some of the scores. So where are you on scalability and sustainability versus operating costs, which are fantastic in Mississippi? You have a competitive advantage there. Business environment. But what about issues of sustainability, scalability, talent? You're going to have to understand how this industry thinks and really understand these measures and drivers. So now let's talk about some interaction. So what do you think? That's a little introduction to the study. And by the way, I'd like to ask the question, who's read the study out there in the audience, by the way? Let me see the hands. All right, thank you very much. Thank you very much, we appreciate that. It's about 150 pages, so when you're on a barbecue over the weekend, you know, take a shot at it, you know? So anyway, but what does business think? I know that the governor and MEC and the team care a lot about what business think in Mississippi. I love Mississippi. When I brought projects here over the last 20 years, you guys get it. You understand it's about action. It's about moving up, getting problems out of the way and making things happen. So your cost and business environment, you already got McKesson up in the northern part of the state, right? I think that's the company. Potential medical business process outsourcing, you got the capability there. But let's talk about some of these challenges. STEM talent. Educational programs, the need to invest in knowledge assets. These are big challenges. This is what your people, you folks, identified during our study. So let's talk about what you think. Here's the question. Got your little quick clickers out. Please rank the challenges and barriers listed below in order of importance with respect to growing and sustaining Mississippi healthcare cluster growth strategies. Here's the options, okay? And I'll tell you when to hit the clickers here in a second. STEM talent, you know what that is? Science, technology, engineering, math, right? Huge skills for the future. The need to invest in targeted educational programs. You got to have that talent in place. Are you going to actually invest in downtown neighborhood development and what you're doing in the metal corridor to have hotels and services? Entrepreneurial funding, venture capital. How are you going to create that? Because it's a big part of what physicians and some people in this sector need to grow their businesses. This whole issue about having primary care physicians, and of course that's a big one. We've talked about that. And then just overall poor population healthiness indicators. And some of these are systemic, some of these are tactical. So let's give this a shot. What do you think are the top two issues, challenges, and barriers that you would like to focus on here in the short term? So we're up to over 400 there. Okay, so I think we're ready probably to show the results. You ready? There we go. 26% for lack of investment in targeted education programs, quality of life, and infrastructure. Number 2, STEM talent. The lowest one, of course, is other. So that's pretty interesting. So I think that's an important message there. It's not just one thing. There's no silver bullet. There's a lot of issues to work on, and some are short-term, and some are long-term, of course. Okay? Thank you very much for that vote. I already talked about the study. Here's another question. What is the priority? Now, there were 8 recommendations identified in the study, and congratulations, you got the first one ticked off. You've got leadership in place for the healthcare industry, and please do support that whole leadership perspective. So, here's the next ones. Financing mechanisms. How do you fund healthcare initiatives? There are some states that have put huge bonding issues in place to position parts of this industry. I'm not saying that's the tool. That's just an example. You got to have money. You got to make things happen. The rural access to healthcare. That could be through technology or e-medicine. It doesn't have to be people, right? There's technology involved. Areas of excellence in healthcare, and we've already started that, of course, with the zones. The statewide healthcare network. This is about working together and collaborating and sharing information using technology, to make sure that, you can treat somebody in Yazoo City as well as you can in Tupelo and make sure that information flows. Regulatory barriers, we talked about that. State competitiveness. Again, now this might be more external in terms of competitiveness or internal. And then, of course, nurturing small business. There's something for this study in everybody, by the way. It's not all about big business. Okay, this is about small and medium enterprise also. So why don't you take a shot at that in terms of what do you think is the most important of those remaining recommendations? Are you ready? Here we go. All right, look at that. People understand that working capital is pretty important, right? You need working capitals to get work done. And then, of course, rural access. I'm so glad that's up there along with, the healthcare network. That shows Jackson is huge to this. That's like your hub to this initiative. But what about the subs? The sub-hubs and the nodes outside of that and how everybody works together. I think that's the message here. There's something into this from the medical corridor side and for the rural parts of the state and how you share and collaborate information. And by the way, this is really great because one of my last slides talks about collaboration and working together. As the governor said, no silos. No silos in this industry. Very, very important. So thank you for that input. Now, you don't have to know everything about this industry. You can look at what other people have done. And I know you've been over to the Texas Medical Center in Houston. Fantastic. I've been over there too. Actually, I was on the roof where the helicopter comes in, and I got to understand that whole cluster. What an amazing, amazing cluster. But let's hold on a second. There's other rural states and opportunities out there. One of the case studies we profiled in the study was Grand Rapids, Michigan. It's a rural state, right? Grand Rapids, probably pretty similar size to Jackson. This is an excellent case study. They have developed something called their medical corridor. They call it the Michigan Street Medical Corridor. They call it Health Hill. They call it Pill Hill. Okay? Tremendous collaboration. $1 billion in growth. Right now, they're seeking grants. They've done some excellent, excellent work there. I would encourage you to tour the Grand Rapids Medical Mile and lessons they learned about linking healthcare to urban development, okay? Sometimes economic development, urban development can be two different things, but you should correlate them very closely here. And then working with private organizations. This was the lessons learned on that case study. Tremendous amount of capital flow that went between the entities. Collaboration, cooperation, the philanthropic nature, just an excellent, excellent case study. And they've also got a new medical school there. So $90 million. So I encourage Dr. Clay and the team to visit these clusters, understand what they've done. And yes, you want the aspirational Texas side in Houston, but you want to understand what's going on in rural states too with some of these corridors. Another case study, recently announced in the Atlanta area, Athenahealth. It's cloud-based services for physician practice management. Cloud-based services, whoa, wait a second. This industry is very web-based, cloud-oriented, high technology. Okay, this gets into broadband, right? Gets into your infrastructure. Do you see the correlation of this industry back to what you need to do in Mississippi? And this is just recently located in the Atlanta suburbs. Big part of this was their IT infrastructure. No, I'm not going to say that you're going to compete with Atlanta on projects like this, but back to that STEM talent, the IT sector is going to be very, very important. So what are we going to do in the community colleges, your universities here, to look at the capacity of IT talent, computer-based programs, actually even how you code. We interviewed a company down in southern Mississippi for the study that said that people don't even know how to code medical procedures into the right systems. So you need medical coders. So there's going to be some asset mapping and looking at skill types that you're going to need to make sure you're competitive in this industry. And Atlanta's done a great job at that recently in this sector. And this was about an academic environment, academic institutions, a lot of vendors coming together. So this is, by the way, this is one of your clients, right? So you can go back to this company and say, hey, we want to get involved in this sector also. All these linkages to be involved with. I love going to the top. Understand why industry locates there. You go there, get in front of these folks and say, hey, what are you going to do in 5 years with this industry? We'd like to participate. It doesn't have to be small, large, 1,000-person operation. You'll take 10, 20, 30, 50-person jobs, right? Medical device manufacturing was also identified in this study. Johnson & Johnson, GE Healthcare, Philips Medical Systems. This is also about foreign direct investment. I think Mississippi has an opportunity to jumpstart across what might be a domestic recruiting strategy and go to foreign direct investment. You have an excellent reputation. Your structural costs are very competitive. And I just got back from France on a sales call with a company in this industry, and they said, well, what about the southeastern United States? They don't know the states or the corridors or clusters. You have an opportunity to participate in this medical device manufacturing. Now, a lot of this industry has gone overseas. You understand? It's gone to China and Puerto Rico, right? But you've heard this concept called backshoring, nearshoring. If you look at the cost of quality these days overseas, things are starting to level out, right? So I'm very encouraged by that, and I think Mississippi is probably one of the top 5 states. Did you hear that? Top 5 in terms of positioning yourself for industries like this that are backshoring, and you have an opportunity to be global with this initiative, domestic, regional, and inside the 4 walls. You've got 4 dimensions, if not 5 dimensions, to play with in this healthcare sector. You understand that? That's a lot of dimensions. All right. And I'm going to get in trouble for this slide, but I don't care, because I care about Mississippi and what you're doing here, and I love that we were involved with this study. I just got back from Quebec City and visited with a company called Medicago. They are going to start making vaccines from plants, not eggs anymore. They have a new procedure where they're going to do it from plants. Now that opens things up, right? So they're looking for North American presence and European presence. They need new capacity. I was just in Canada with them. So fantastic process, toured their plant. You never would have thought of that, right? But again, if you study this industry and understand what's going on in these sectors, you're going to see opportunity. I just got back from Lille, France. I visited this company called Macopharma. It's a $1.6 billion company. Never heard of them. They are looking at producing blood kits in the United States. These blood kits are because of the Red Cross and things of that sort, okay? These are semi-skilled. This is not a high-skilled operation. They have a lot of semi-skilled, lower-skilled labor in this facility. They're looking for an available building, low structural costs, okay? And they want a place where they have a pro-business environment, and they want to have a good workforce. Does that sound like maybe like Mississippi can compete in that? So they're asking me what the search area is. Now, I just worked on a project right now. I'm working on a $12 billion high-tech electronics project right now. Phase 2 is another $12 billion. I'm not kidding you. It's signed up. I'm working on it. As soon as I leave here, that's what I'm working on. The client asked us, what should the search area be? You're the expert. What state should be included? So how are you going to make me confident that I'm going to put Mississippi on the list for these clients and their valuable intellectual property and physical capital? You're going to have to get out there, advertise this industry, make people understand you understand this industry to be competitive. And there's opportunities like this. And this is a really weird one. I got called into a sales call at Marshfield Clinic a couple years ago. You're like going, Marshfield Clinic, what are you doing there? And there was sitting around with 8 doctors, and it was a top secret meeting. They shut the door, and it was quiet for like 3 minutes. Then they finally started in. Bob, we heard about you. We have the situation up here where we've been using the local genotype and demographic as our lab for the processes and clinical research that we do in northern Wisconsin. Hey, a lot of Scandinavians like me and Germans, okay, studying certain diseases. We want to take that process, because we're running out of that genotype, and do it somewhere else in the United States. We were thinking the southern part of the U.S. And I won't get into the genotypes or the demographics that they wanted to test, okay? But it might be related to what you're doing in Mississippi relative to obesity. So I get involved in these really crazy opportunities that are unique. And this healthcare sector is full of these opportunities that you would never know that these opportunities exist. Imagine taking a business model from someplace else and deploying it here in Mississippi. So there's opportunity out here. I just wanted to encourage you to think broadly, but not too broadly, to focus in on these sectors that I'm talking about. This is a great one. California companies. It's a great place to get business. Here was a doctor, a CU, who went to a school in Texas. He founded the company in California in 1992, okay? So he went to California. Why? Venture capital, great talent. He could incubate his company, right? And at some point, when you start scaling and be sustainable, he doesn't want to grow in California anymore, 13% income tax and all those crazy things we hear about, okay? So he said, I need to find the next location for the second stage of my company. So what did he do? He went back to his hometown, his home state in Texas, and he won this project. This is a great example, 142,000 square feet, 240 employees, excellent opportunity. I'm sure you're going to have people in Mississippi that have left here, and they're going to want to come back. So there's another channel for you, right? Excellent, excellent case study right there down the road in Texas. And this is my favorite one. So I've been talking about big companies. What about just what happened in Magee with Mayor Jimmy Clyde? We were on the phone with him a couple days ago. What a fantastic project. Hey, won an award for this. The Medical Towers project, 50,000 square foot, pharmacy, home health, medical supplies business. This fits right into this healthcare sector. 37 full-time jobs. These are good-paying jobs. $4 million capital investment. How big is Magee? I don't know. What's the population? I mean, look at that. Look what they've done. And the last statement, what he said, it's making Magee a desirable place to live while attracting economic growth. I love this case study. We need to hear about more case studies like this. And lastly, on the case studies, don't you have this company in your state right now? Pretty big facility. We toured it as part of the tour. By the way, on this study, we interviewed over 100 people, and I ate in Yazoo City, and I ate in all these cities I never ate before, okay? I mean, we were out there. This isn't some academic study. We worked our butts off, okay? We were trying to make this sustainable and real. We interviewed the Baxter facility. We sat with the plant manager. They just competed for a product with the other Baxter footprint across the country. They didn't win that line. The folks up in Lake County, Illinois have other ideas and images about that. So you should be up in Lake County, Illinois, which is right in my backyard, talking to Baxter about what you're doing with this healthcare initiative. Well, Georgia recently got their plant. $1 billion, plasma-based treatments, and they lost to North Carolina 4 times in the last 10 years on Baxter projects. They stuck with it, right? It's called sticking with it. They lost 4 times. Big project. Look at that salary. The economic impact, this was a big win for them. And, let's be careful. I mean, it's not all about elephant hunting, right? But you do have existing industry that you can leverage in the state. And again, this is a very active sector of the economy. Small, medium, large enterprise, certain sectors of the healthcare. By the way, Baxter. So here's Baxter Life Science, biologics, biotechnology. Hey, that's pretty tough competition. San Francisco, Ireland, Singapore. Or is it healthcare? Again, make sure you understand both those sectors and where you want to spend your time in terms of attracting, nurturing, and industry. So just to sum this up, this was about market, talent, and resources for all 3 of these projects. It was about strategy, about finance, about operations, and lots of intangibles, relationships, confidence, and certainty. That's what it was all about. So now what? Now what do we do? Where are you going to err? So what did you see in these case studies? Did you observe what was going on? First thing I saw was know thyself. They understood who they were and where they could compete. They had short-term and long-term perspectives. I saw a tremendous public-private sector partnership. By the way, I'm with the governor. We're not going to wait for Washington and the federal government to drive what's going to happen on the ground. Great things happen in the field. That's what I tell my team as their leader. Hey, I'm just some old guy who doesn't know a lot. I'll give you the resources and provide the leadership, but I want you all developing things in the field. Bring them to me and we'll make them happen, okay? So that public-private partnership is going to be very important to this. Collaboration, all the hands together. You know, it sounds like a corny word, but how are you sharing information, business intelligence? Is Jackson sharing things with Tupelo? Is Baptist get along with the Tupelo organizations? That was one of the issues in the study, is how people communicate. It's competitive. They're competing for patients. Let's make no bones about it. It's a competitive industry, the healthcare industry. But you have 4 million people in the state of Mississippi, okay? There's clusters around the country that are just one town that size. You got to work together. It's shared risk and reward, okay, to get your fair share of this industry. And you see that on the lower left-hand corner? That's leadership. And that's starting to be put in place, and that's going to be very, very important. Who's going to drive the passion, the enthusiasm? The block and tackling is going to be very, very important also. We saw some people are working very hard, very tactical, boring things. You know, and then, of course, awareness. This little triangle down the bottom corner, that's a symbol of what's the image of Mississippi for this industry. Right now, you don't have an image. Might not like what I said, but people in the site selectors industry, you don't have this image with them right now, or with a lot of corporations. But you know what? It's pretty simple. You already have somewhat of a cluster here. You're developing this. Nobody's doing this like you're doing it. And it's like the governor said, you're going to leapfrog, steal for some folks, and make it happen. So get out there and make people aware of things. Things will happen. Maco Pharma and Medicago will at least give you a look, right? That's what it's all about. So let's talk a little bit about what drives success moving forward. So we talked about knowing thyself. Working to be competitive, what segments of the healthcare incremental gain, right? That's what that means. Public-private partnership, government and private sector working together, shared risk and reward, targeted investments, collaboration, communication, breaking down the silos, leadership, a champion to the cause, providing direction, block and tackling, the willing to take risk, failures, research and data, fundraising, real boring stuff, hard work, right? And then, of course, awareness, education, and conversion. So which of those do you think should really be the focus moving forward on tactics? Please vote. Da, 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 da. There we go. Go. All right. Excellent, very interesting results. Public-private partnership, collaboration. You know, that was one of the themes of the study. This is an industry, like the governor said, that maybe doesn't necessarily communicate like they should. Look at that. That's right up. I love these results. Yeah, they're all important. But working together and different sectors of the economy working together, that's economic development right there. Right there. That is world-class economic development, and you guys can do it. Very, very interesting results. Thank you for bearing with us on the voting process. Okay, so last closing comments. For our healthcare leader, for the leadership of Mississippi, for this whole healthcare initiative, please focus now moving forward on understanding business drivers. Understand their markets. Understand talent. Talent is going to be a big part of this. Attracting, retaining, sustaining, and the resources. Please do your audits, your inventories. Please make sure this is your roadmap. These are the 3 things that drive job creation wealth. It's the markets. You have to understand the demand side. The talent base is so important to this, and this gets into all different types of skill sets. And of course, the resources you have. Raw materials, capabilities, intellectual property, financial. These are your 3 dimensions. So, think differently. Position healthcare, importance of EDCs, its economic impact. And by the way, how many economic developers are in the audience? All right. This is an industry that traditionally hasn't been that, I'll call it interesting to economic developers. You know, hospitals and clinics, they just happen. You know, it's just part of a service thing. I want to focus on that next Nissan plant. Okay, I get that. That's important, but this is an industry now that you need to learn about, read about, understand, because it is an economic driver, and the statistics are there, and it's the future. It's an industry of the future. What I like about it is it diversifies Mississippi's image. and strategic position in the marketplace. I love that about what you're doing. You're just going to go kind of right around people, and if you're out there and you create that awareness, you're going to get your fair share because you all work together and you have the structural basis to make it happen. The STEM skills, very, very important. The quality of place, I talked about that. I mean, you can't have the top-notch doctors in the world you want to recruit from the universities and schools around the country. They want to live in good places, and they got kids and schools. This is so important to them, okay? Communication, of course. And then lastly, leaving political motivations behind, and don't bring them to the front line where economic value is created. I'm working with, I've done 300 site selection projects in my history. And I still have states and regions bring political solutions to the table right away. No, you can be political, but you should channel that to what's important to the company. Get out of the way, make things happen, make it actionable. You know, give me a place where I can be profitable and sustainable. Yeah, you can get me there, but you can give me the aftercare to be sustainable in the healthcare sector. And what I've seen in this whole study is the will and the capability and the cunning from you all to make this happen. And so when I come back, I'm going to retire in a few years from this business, okay? I want to come back here, and I want to see the success because you could make it happen. So sorry about the Newt Rockney thing here, but I believe in this and what you're doing, and please, please make it happen. Thank you very much.